Well, the first thing to say is it's not a difficult test to do, and certainly in comparison to spirometry, it's ridiculously simple. And the second point to make is that the result will be accurate. The machine will not give you a result unless the test has been done correctly. So there isn't the issues of measurement error that we sometimes get with spirometry. So that's the first point. I believe every patient with asthma or suspected asthma should have type 2 airway inflammation assessed. We've looked recently at a clinical trial population from the novel START study. This was a study that we were involved in Oxford that was driven by Richard Beasley in New Zealand, which looked at treatment options in patients with really mild asthma. So these were patients that have normal lung function, and they're getting symptoms infrequently, so they're using on average around 2 puffs of Ventolin a week, so really not patients with significant issues. And we looked at just as needed salbutamol compared to a regular inhaled steroid, compared to a third arm that had as needed Symbicort, which is a combination of formoterol and steroids. And the group that were randomized to as needed salbutamol, so the group that didn't have any steroids, when we looked at their biomarkers, the people with evidence of type 2 airway inflammation had a 5-fold increased risk of asthma attacks during the year of the study. So I don't know why you as a doctor don't want to know that, why the patient doesn't deserve to know that. And if the patient did know that they were at particular risk of having an asthma attack, would they make a better decision about treatment? And I think they maybe would. What we also showed in that study is if you were taking an inhaled steroid, and it didn't really matter whether it was a regular or as needed inhaled steroid, that excess risk associated with type 2 airway inflammation was eliminated completely. So the biomarkers were telling us that this person, they've got mild asthma, but they're at risk of an event that we really don't want to happen. Moreover, that risk can be eliminated if they commit to a regular or as needed inhaled steroid. So yeah, I really cannot understand how we can manage asthma if we don't get this information. You know, we're simply not in a position to make good treatment decisions. That's my view anyway.